So friends, today we are going to study about migraine. It is a mysterious disorder characterized by pulsating headache, usually restricted to one side, and it comes in attacks, and attacks last for 4 to 48 hours. Friend, it is associated with nausea, vomiting, sensitivity to light and sound, vertigo, loose motions. Types: there are two major types of migraine, one migraine with aura and other migraine without aura. This one is also called classical migraine and this is called common migraine. It is preceded with a visual and other neurological symptoms. Now come to the pathology. It is not well understood in case of migraine, but there is a pulsatile dilatation of the cranial vessels, which is the immediate cause of pain, and there is also release of mediators. The mediators being here serotonin 5-HT, substance P, nitric oxide, calcitonin, gene related peptide, and neurokinins. Now come to drug therapy of the migraine. It should be individualized and it depends upon the severity. First, we take here case of mild migraine. Mild migraine, here the attack lasts for at least 8 hours and there are less attacks, means fewer than one attack per month, and it do not incapacitate the individual. In this case, the drug therapy is simple analgesic like paracetamol and aspirin, B, and non-steroidal anti-inflammatory drugs, for example ibuprofen, naproxen, and diclofenac, and if required antiemetics are used. Now come to moderate migraine. In this case, it lasts for 6 to 24 hours and it functionally impair the individual. In this case, the drugs used are non-steroidal anti-inflammatory drugs combinations and sometimes triptans according to severity and the frequency of the attack, and ergot alkaloids and antiemetics are usually required in this case. Now come to severe migraine. It is that migraine which lasts for 24 to 48 hours and it grossly incapacitate the individual. In this case, triptans are mostly used. Triptans and then ergot alkaloids can be used. Plus antiemetics are always used because in this case the vomiting is usually common. It is also prophylaxis here. In prophylaxis we give propranolol, it is a beta blocker. Then we give amitriptyline, it is a tricyclic antidepressant, and fluranazine is an E. Fluranazine, it is calcium channel blocker, and anticonvulsants are used. So this was the migraine.